The purpose of this educational video is for the individual to be able to identify correct type, dose, and timing, correct injection technique, optional injection sites they can use, priming and setting up the insulin pen, and knowing the correct range for CBG tests. According to My Health Alberta, there is rapid acting, short acting, intermediate acting, and long acting insulin. The one you take depends on many factors. For example, short acting doesn't have a long duration, so it would be taken before a meal so that when you eat and the sugars spike, it will be at its peak to lower the amount of sugar in the blood. Versus long acting insulin has a long duration, which can create a steady base of insulin throughout the day. Which kind of insulin you take also depends on certain factors for the specific person. Diabetes causes the pancreas to either not recognize insulin or stop producing insulin. This causes the body to be susceptible to low and high blood sugars, considering the pancreas doesn't perform its natural cycle, according to Mayo Clinic. There are common signs and symptoms of hypoglycemia, such as feeling lightheaded, fatigue, sweating, shaking, and looking pale, according to Mayo Clinic. To avoid having these symptoms of hypoglycemia, it is important to check your blood glucose levels to protect yourself from becoming too low. According to Dexcom, a normal range for blood glucose levels should be 4.0 to 7.0. All right, so this here is a rapid acting insulin. It has 3 mils of insulin in the vial. This here is the units, and this dial will turn it to the amount of units that you want to set it to. Okay, I'm going to prime the needle now. So we are going to take the cap off, and then we are going to twist it on to there till it's tight. And now we're going to prime it. So we're going to set the dial to 1. There we go. Set to 1. And now we are going to press in on this. There we go. And now we know that we have the needle primed and ready to go and that there are no air bubbles. Okay, here today I have my patient and she's going to show me that she knows how to properly prime the insulin pen.
I have my needle cap. I'm going to take the lid off, twist it on until it's tight, and then I'll set it to 1, prime it, and then I would set it to what I needed, take both caps on, clean my injection site, and insert.
Okay, so for this next part, we are now going to inject the insulin, but before we do so, we have already primed the needle, so now we are going to set it to the units that we need. In this demonstration, I'm going to set it to 4. So turning the dial, we're going to set it to 4 units, which I have done there, and now we need to inject it into the site. Okay, so when we inject the insulin, there are a few different sites that we can do. We want to find somewhere that has some fatty tissue. So you can do the upper outer arm, you can do the abdomen, you can do the upper outer part of your thigh, and you can also do the glute. Come on, Mom. Okay, for this demonstration, we're going to be using the upper outer arm. Before you start, it is important that you sanitize the area where you're going to be injecting. So here, clean the area in an inner motion to the outer. Let that dry for 10 seconds. Then you're going to take your insulin pen and you're going to remove the cap. You have it set to 4 units. You are now going to take the back of the arm. You are going to inject. You are then going to hold down on the plunger, and then you are going to count back from 10 to ensure that all insulin has been injected. Once you have done that, you can take it off, and then you want to remove the cap and put it in the sharps bin. This information is critical for individuals diagnosed with diabetes because it can give proper education to ensure the individual's health is protected by performing these tasks shown throughout. Taking care of this disease will allow for a healthy lifestyle and prevent other diseases caused by poor management of diabetes.